Good evening, everyone. My topic for presentation is efficacy of topical interferon as a newer modality in pseudophakic cystoid macular edema. A cystoid macular edema is a frequent pathological condition affecting the retina and can arise from various underlying issues, including intraocular inflammation, central or branch retinal vein occlusion, diabetic retinopathy, and most commonly after cataract surgery. Traditional treatment encompasses a variety of methods for administering steroids, NSAIDs, immunomodulatory treatments, biologics, or anti-VEGF medications. Interferon, a glycoprotein hormone with cytokine-like properties such as immunomodulatory, anti-proliferative, and anti-angiogenic. The release of interferon into the circulation initiates a series of chemical reactions that safeguard cells from harm caused by factors such as low oxygen levels, limited blood flow, edema, as well as reduced inflammation, and prevent cell death. This study examined the effectiveness of topical interferon in treating the pseudophakic macular edema. Materials and methods. This is prospective interventional longitudinal study conducted in Regional Institute of Ophthalmology in Prayagraj. Inclusion criteria. Patients aged 18 to 75 years diagnosed with pseudophakic cystoid macular edema following either SICS or phacosurgery and advised for intensive topical, systemic, periocular, intraocular steroid therapy. Exclusion criteria. Patients with macular edema caused by conditions other than pseudophakic cystoid macular edema, patients exhibiting ocular manifestations such as conjunctival hyperemia, follicular hypertrophy, giant papillary conjunctivitis, irritation, corneal epithelial defects, flu-like symptoms, or severe dryness at treatment initiation, patient lost to follow-up. Topical interferon alpha to beta eye drops were prepared using subcutaneous interferon 3 million international units diluted in 2.5 ml of sterile water to create a 3 ml solution of 1 million international units per ml. Patients were instructed to store the prepared solution at 4 degrees Celsius and used it as directed. Participants were divided into two groups of 8. The experimental group received both topical interferon and intravitreal steroids, while the control group received only intravitreal steroids. In the results, the above table shows comparison of vision between groups in pseudophakic cystoid macular edema by independent sample t-test and in all time durations, and there was no statistically significant difference at every point of time except at 1 month, which is highly statistical at p-value less than 0.01 levels. In the table, the above table shows comparison between the groups in central macular thickness. The above table in pseudophakic cystoid macular edema at all time durations shows no statistical significant difference at p greater than 0.5 levels except at 2 weeks, 1 month, 2 months, which show statistically significant difference at p values less than 0.05 levels. These are the images of a patient in pseudophakic cystoid macular edema case group, in which it was completely resolved at 4 weeks post-treatment, whereas in control group, the macular edema was still there at 4 weeks post-treatment. Discussion. Central macular thickness showed statistically significant reduction at 2 weeks, which became highly significant at 1 month and remained significant at 2 months follow-up. But at 3 months and 4 months follow-up, control group also showed a reduction in CMT equivalent to case group. The mean time taken for complete resolution of CMT in case group in pseudophakic cystoid macular edema was 4.6 weeks, whereas it was 11.6 weeks in control group. Best corrected visual acuity significantly improved at 1 month post-treatment in case group compared to control group, but at later follow-ups was statistically insignificant. PCR was present in 5 out of 8 patients in case groups as well as control group. This might be the reason of penetration of eye drops in the posterior segment of the eyeball and such dramatic improvement in CMT and vision in 1 month. 5 out of 8 patients in a short case series with pseudophakic cystoid macular edema by Cavalli et al. Showed substantial recovery in less than a month, and it was assumed that this was connected to posterior capsular opening. One patient developed macular hemorrhage at 2 months follow-up, although showed a resolution in CMT up till 1 month, which most probably is an incidental finding, but the treatment was stopped immediately. One patient developed papillary conjunctivitis at 2 months post-treatment with the eye drop and was given mild steroid eye drops without stopping the treatment, and resolution occurred in few weeks. To conclude, our study demonstrates that topical interferon alpha to beta is a promising adjuvant therapy for pseudophakic macular edema, resulting in earlier resolution of edema and best corrected visual acuity improvement compared to conventional treatment. However, long-term outcomes showed comparable effectiveness between the two approaches. Topical interferon was well tolerated with minimal side effects, supporting its use as a safe and effective adjunct. Thank you.
Just one question. What is the mechanism of action of topical interferon?
Sir, it is an interleukin. It works on interleukin 6. It is interleukin 6, interleukin 7, 11. It is anti-proliferative, anti-inflammatory. These are the reasons for macular edema in the posterior segment. So it works on these.
Any corneal toxicity?
Sorry, sir.
Any corneal toxicity?
So in few previous studies, corneal dryness and in conjunctiva papillary conjunctivitis was seen. But in our study, sir, only one patient had papillary conjunctivitis, which was resolved, and corneal dryness was not seen.
Thank you.
Thank you, sir.